Good morning. This is Andy Reese from Department on, or good afternoon. Sorry, this is Andy Reese from Department on Disability Services. As always, I'll first provide an update. Unfortunately, once again, yes.
Just hold on 1 second. Don't have the interpreter. Give me 1 second.
Oh, sorry, folks. We'll start in a moment as soon as we have the ASL interpreter ready to go. Good afternoon. Great. I was making sure as I'm looking that you were connected and interpreting. So now that we have the interpreter with us, again, good afternoon, everyone. As I said, unfortunately, this week we did have one more person test positive for coronavirus, and that person is hospitalized currently, which means that we now currently have 2 people hospitalized for treatment of coronavirus or recuperating from in one instance. Of the people who have tested positive for coronavirus, 33 have died. 2 of those were later determined to be not caused by coronavirus. So our actual, at this point, coronavirus-related deaths or deaths that have been attributed to coronavirus are actually 31. Requiring no inpatient care out of 256 people who have tested positive, 139 have not required inpatient care, and 82 have been discharged. 82 of those who are currently alive. Some of the 33 did get inpatient care. The placement types for the people who have tested positive is 4 have been in a host home, 86 were in an intermediate care facility, 26 were in their natural home, 2 in a nursing home, 27 in a residential habilitation placement, and 111 in supported living. To date, amongst our provider agencies, 345 staff have tested positive for coronavirus, which includes 30 people who worked at more than one agency. And among those, they have lost 8 staff to coronavirus. Some good news this week, we did get approval from Centers for Medicare and Medicaid Services on the waiver amendment that was submitted for the IDD waiver. We believe that we should be seeing very soon the final approval on the IFS waiver, which is scheduled to launch November 1st. We have addressed all the issues. We just haven't gotten the formal approval on that one as yet. The waiver, the IDD waiver amendment, there was one change that CMS required, unfortunately, which was that we, in our waiver amendment, had attempted to change the definition, sorry about that, to change the definition of who could be an AT provider, which would have allowed to include a residential provider of waiver services, which would have allowed all of our residential providers to purchase AT equipment and get reimbursed. And that mechanism was not allowed by CMS. They said that those had to be what was in our existing waiver, which is an approved AT provider in our waiver, which would be someone who's currently approved to provide occupational or physical therapy or speech language services, or someone currently approved to provide PERS. We do have 2 providers who are currently approved to do technology. I'm forgetting what they call it, but to purchase technology not just to do AT assessments, but also to purchase technology. In addition, an approved RSA assistive technology provider can be approved to purchase AT equipment or provide AT services in the waiver, but they do need to go through the process to become an approved Medicaid provider. So amongst the RSA providers we have who are approved assistive technology providers, they could also become providers within the waiver. There are 2 agencies currently that are approved. And so if there were need for purchases to occur in the very short term, we would provide people with those 2 agencies, and people could select from the 2 of them which one they would prefer to use. In the IFS waiver, as I said, we haven't gotten the final approval yet, but one challenge we ran into was with adding the education service. There were some aspects of it that were approved and some aspects that have, I will say, not yet been approved. We had a choice of removing it completely, going forward with the limited education support that they would allow, or challenging their decision and delaying implementation of the whole waiver. We chose to go forward with the limited amount of education support that they would allow, which was education supports for people to develop communication skills. We are continuing to work with CMS on the concerns that they had regarding the other aspects of the education support in our waiver. We pointed out to them that CMS itself had approved the exact same service. And when I say exact same, I mean we cut and pasted it from another state and did change to indicate that it was the district, but changed nothing else in it. But in their review, they said that the way that it was constructed needed some changes. And so we're working with them over the next few months to rework that so that we can get it in place as close as possible to what we had originally proposed. Someone did that for me. I want to thank you, because I was looking at PERS saying, I'll say it and I usually spell things out, but only when I know what they mean. So PERS being Personal Emergency Response System. So we received no questions today. So if people have questions, please type them into the chat box, and we'll have a conversation. So as in other weeks, we do have Daryl Hawkins from DC Health with us, fortunately. So one of our first questions is for her, which is, will DC Health be offering...
Sorry, can you... So we are giving more than one training session. And I know that folks have to register ahead of time because it is in person next week. And for the space, we want to make sure that people are able to socially distance. But there are more than one day for the training. Thank you. I know one of the days is Monday. I'm not sure if they've already finalized the second day.
Thank you, Daryl. And just to restate the question that Daryl just responded to was, will DOH be offering more than one training on the rapid test kits? Training is set for Monday. We got the notice yesterday. So as Daryl said, there will be additional dates. How many RSA providers are there who are qualified for AT if they went through the Medicaid process? So if all RSA providers are currently eligible to be AT providers, I don't believe there are any RSA vendors currently approved to do the service, but it is one of the qualifications that they can use. So there are, any RSA approved vendor can become an AT provider in the Medicaid, through the Medicaid process. And while we wait for Director Reese to rejoin us, just please type any additional questions into the chat box. Thank you.
So I am now Winslow Woodland. My computer crashed, so I just came down to Winslow's office. So I hope people can hear me clearly since we're sharing an office now. I have my face covering on as required. So if there are questions, please share them.
I'll just remind everyone to please share your questions to everyone and not just to the host or to the panelists. Just make sure that you click on that Everyone tab. Thank you. Director Reese, a question just came in. Is there a copy of this information you are reading for the provider? If so, can you send a link? I imagine they're describing the IFS and IDD amendment information. I'm not quite sure.
I mean, if people are asking about that, we will have that information posted on our website before those go forward. Has there been any change or update to the DC Health face mask requirement for staff in all residential settings? Not since we've spoken last. No, there has not.
I've received some additional questions here. Are providers required to complete the retainer payment attestation if they did not bill for retainer services after June 30th?
No, they are not. The attestation is only required from the point in time that that CMS issued the guidance requiring that attestation in order to get payment, and that was issued June 30th. So any payments up until that date do not require the attestation.
Another question came in privately. The new DC Health guidance indicates that cloth face coverings are required for residents. Is that while they are in the home, and does it apply to waiver settings?
Perhaps Daryl can respond to that. I think she has responded to that before, but that's.
Hi, this is Daryl Hawkins. So with regards to cloth face coverings, those that are living in the home with each other, if no one is under quarantine or isolated, they are not required to wear cloth face coverings around each other because they're household members, right, to each other. However, we are going to require cloth face coverings if those who are living in the home are around other individuals, for example, during outdoor visitation or for or if they're going to leave the CRF or supported living to go to visits, if they're able to tolerate it, they should be encouraged to wear cloth face coverings as a form of source control. Thank you.
So there was clarification, but I had understood the question as at any rate, which was, is there been any change or update to the face shield requirement by DC Health? And no, there has not been any update from what we've discussed in the last couple weeks. During the last EVV session, it was said that before the DSP clocks out, he will respond to a few set of questions. Do we have then to keep asking for progress notes? Is it not going to be too much of an expectation? I will see if Donald is here and can be put on the panel to answer that question, but I will also say, yes, you still have to do progress notes because those are two separate questions. In terms of the DSP responding to questions, that is simply about documenting the time that they've spent with the person. And at least the provider that we have, I don't believe that connects to your case management system and uploads progress notes. It may be that our providers have someone who does EVV that does work that way. But as I said, if Donald's here and can respond further, I'd be happy to have him weigh in, please.
Good afternoon, everyone. As far as the EVV system and I think what they're referring to is when the DSP clocks in and out, they have to use a drop down, which has specific codes aligned to it to say what tasks were completed during the visit. They'll elaborate on this in November's training, and we'll be training DSPs on how to use the app and how to use the particular codes associated with each task that's completed.
But Donald, to your knowledge, does that system interact with the case management system that would that would cause that to become a case note to then not have to enter a case note?
So, Director Reese, are you referring to, for example, if the DSP uses THERP or anything of that nature?
Yes.
Yeah. Not to my understanding, it doesn't kind of duplicate that note in THERP. So it would be in the app, and really it goes straight to DHCF system against the authorizations.
So I would encourage people then to go to the November training, and you could follow up on that question at that November training with DHCF. Someone asked if you have to be an RSA provider to apply to provide AT services. No, it was just added as RSA assistive technology providers can then become waiver providers of assistive technology. Anyone who has OTPT or speech language services is also qualified to be an assistive technology provider, and then they could also be qualified to purchase assistive technology equipment. Is there any potential for appealing the CMS decision restricting residential providers from AT reimbursement? No. I mean, to have challenged it would have delayed implementation of the waiver, but even when you challenge it, no.
And Director Reese, this is Donald again, pertaining to ongoing work and what other potential solutions are through the Tech First initiative is really working with other Tech First states to see how in the future we can move forward with maybe new service definitions that allow for waiver programs or providers to access some of those universally designed pieces of tech that are not primarily designed to support someone with impairment, but have also proven to be just as effective and also multi-functional, so that we can get a hold of those devices that way. But that is some ongoing work in through the Tech First work group to see what new descriptors we could come up with to encompass that and set us up for in the future that when new emerging technology comes available, that because of our descriptions or our service definitions, that we're not able to make them accessible through our program.
What's challenging as this new technology, or, you know, when any new service is coming on board, all the states do try and work together to determine how we work with CMS to most effectively provide those services. And, you know, what we learn sometimes is that unfortunately, even when you do something like with the education service that was previously approved by CMS for another state, you then have different people reviewing it, coming to a different determination. And in that instance, potentially going back to that original state and questioning the service that they've already got in place, unfortunately. Which is why we often work closely with the National Association of State Directors of Developmental Services to ask them to ask CMS on our behalf, so that we can try and get a consistent answer that works for all states. We actually have our annual meeting coming up soon, and CMS attends that, so that, you know, hopefully helps us to be able to move forward with this. As you start to introduce new services or new technology, it can be challenging because they can be very strict in their interpretation of rules that exist. So on the Appendix K, EPD services were permitted to pay parents or family guardians and family members until the end of the pandemic. Emergency for services that initially did not allow this. My question is, does this also apply to IDD waiver, specific companion, or IDS?
I have interpreted it to encompass the EPD waiver. So I have advised certain providers who've inquired on this that their family members could, in the event of emergency, be the staff assigned the authorized.
All right, I think we're having some technical issues. Just bear with us for a second.
So just to clarify, within DDS, or within DDA, with the IDD waiver, there have been circumstances where providers have been able to hire family members. The reference in the EPD, in the Appendix K to the EPD waiver, relates to Services My Way, allowing the flexibility there. So it is different how the two flexibilities work. They don't work the same way. So the language here that relates to the EPD waiver does not apply to the IDD waiver. However, there are some circumstances where providers have had the flexibility to hire a family member. But we'll make sure that we thoroughly work that through and give a more thorough and complete response next week.
Director Reese, I see a question here that says, in the day program reopen and plan, emphasis is given to specify material to use to make sure our people are safe, which is good. However, is there a plan to assist providers to get access to these resources?
No, there is not. we have worked with providers to make sure that they know where they can get access, and DC Health is available to help them get access, but there is no additional, if someone is referring to assistance with getting resources, meaning are we providing those resources? No. I am aware that the Provider Coalition and prior to this, and I don't know if they're doing it currently, had gotten together and made purchases in bulk, which then also significantly reduces the cost. So for day service providers that are part of the Provider Coalition, you may want to speak with them about whether they are working on that.
There's another question here, I guess for Donald or for you, Director Reese. Is there an update regarding EVV for services that have been approved to be provided remotely / virtually? How will this be implemented with the geolocation restrictions?
Yes, I can answer that. As of to date, DHCF's focus is on in-person personal care services, physically in-person personal care services. It has not, I have reached out to other DD systems who are also obviously have to be in compliance with EVV, and they have not been instructed that remote supports of any nature at this time must be included in EVV. With that being said, such as another service that has been brought up and inquired about being implemented into EVV is companion services. That there's always potential for a second phase of implementation to include additional services. So I'm not saying that this is a long-term definite as far as these services not being included in EVV, but for this first phase, we're looking at a certain host of services such as supported living, in-home supports, respite in-home only, and personal care services. And let me be clear, supported living periodic on an hourly rate to be implemented for the first rollout of EVV.
So I see MTM says that they can pay DSPs to transport a person in the DSP's own car. Is there a concern with the car of the DSP not being insured for such transportation? That would be an issue to raise with MTM. If MTM is paying the DSP to transport, then if they have any insurance requirements, they would then work that out with the DSP. They may be assuming, I don't know, that DSPs use their car in their employment and already have that kind of a rider. I mean, the DSP themselves ought to be concerned about this, but all of these are issues between the agent, the DSP, the agency the DSP works for, and MTM. There's a comment here, I assume, for Donald to respond to. In-home services, which are EVV enforced, have been approved, some or all 100% virtual.
Yes, this goes back to, and I think what we always have to keep in mind is that what is considered personal care services that are provided during an in-home visit. CMS definition of that, and the key thing is in-home visit. That is their definition of personal care services, along with the supports that provide supports to ADLs and IADLs at that time of that in-home visit. Virtually, as of now, they have not specified visits that are done in that manner virtually. They're saying in-home visits in person, physically. So in-home supports is a EVV enforced service, however, not virtually yet, at least based on that language for CMS. Again, I'm not saying it never will be. We have to be careful with this too, because we go to CMS inquiring, they'll say, aha, great idea. We need to include that as well. So we're taking their language. DHCF is taking that interpretation of their definition of personal care services to be that, and looking at our services that we provide. And those are the services that are going to be implemented in EVV. So as of now, in-home supports or DSPs who are providing those remote supports are excluded from that based on that definition.
Does a provider need to apply to become an AT provider if they are currently approved for OT and speech? Yes. The qualification is that they are an approved OT, PT, or speech provider, or an approved RSA provider. So the approval process should be fairly seamless, but they do need to apply. So if DC Health could provide information about the rapid testing training, it asks whether this is open to supported living or day providers. I expect it's only open to ICF and ResHab because that's the providers for whom the rapid test kits are being made available. But do you have the answer to that, Daryl?
Hi, yes. Hopefully you guys can hear me. The answer is right now that training is specifically targeted to the settings who are going to get these rapid testing deployed to. So as Director Reese mentioned, that's going to be specifically ICFs and CRFs at this time. Did you guys hear me?
Yes,
Sorry.
we got that. Thank you.
Okay, great. Thank you.
So there's some confusion. So if in-home services EVV enforced are approved for 100% virtual, why is it that in-home DSP are excluded? Please help me to understand this.
Yeah, I may need to have an offline discussion to quite understand that question. Let me put my email information in the chat box and we can follow up so I can get better clarity on this question.
And as a reminder to people, the training on the EVV will be occurring in November, and these very specific EVV questions could be asked at that training as well.
And just add on to that, there is the ongoing monthly stakeholder meetings, the third Monday of every month, 11 a.m. to 12 p.m. In addition, there's also the EVV info email address, which I will put in the chat, where questions can be asked as well for the project management team to get back to you.
So for people with questions regarding EVV, you could send those questions to evvinfo, I-N-F-O, at dc.gov. That's evvinfo at dc.gov. So there is a question about whether the rapid testing kits that are being provided are going to be provided to all providers, because we have some residential habilitation providers, what you refer to, Daryl, as CRFs, who are located in Maryland. Will they also get the test kits?
As far as I'm aware, that these test kits are being provided to facilities in the district. I'm not aware whether Maryland has received similar tests and what their plans are for how they're going to be disseminating it, but the intention for the ones that are being disseminated by DC Health are for facilities that are located within the district. Thank you.
Thank you.
And I want to also clarify one other thing, because other folks are asking about these testing kits. Those that do not have these, you please continue. If somebody is symptomatic or you need to test them, continue to go through the normal process. You can ask PHL, the public health lab, for selection kits to do PCR testing still. So that option continues to be available to all providers if needed. Thank you.
Thank you. This is just one additional, the access to rapid testing for DC-based congregate settings. But all of the other testing options are still available for people. Oh, and I sort of read something into the question, or didn't read part of the question regarding the availability of testing. It says, is testing required for Maryland residential habilitation locations? The availability of rapid testing is not because some additional requirement regarding testing has been imposed. It is to make rapid testing available when it is needed. So the requirements regarding testing have not changed in the district. So I'll give people a couple more minutes. It appears we have no additional questions at this time. It's 12:47, so if we don't get any by 12:50, then we will go ahead and log off and hope everyone has a wonderful weekend. I think, so Carol shared with everyone, we must be a tired bunch. It may also be that we are adjusting to our new normal and we don't have as many questions about our adjustment to it. That would be my hope. And I'll add to that hope as we see other parts of the country with their spikes in coronavirus, partly related to the oncoming flu season, partly related, I expect, to people getting tired of continuing to take the kinds of measures they need to take to ensure their own health, like wearing a mask, maintaining physical distance, washing their hands regularly, that, we have to be ever vigilant to continue to do these things. And in the same way, also being sure that we're taking care of our health generally, which people need to be consulting with their doctor about, a flu vaccine, as well as any other recommended care that they need to make sure that everyone is taking good care of themselves. There have been reports recently about across the country, the significant increase in deaths this year, not directly related to COVID, but, when you see that it was over 300,000 additional deaths in 2020, it is a reminder that not only do we have to protect ourselves from COVID, but we also have to take good care of ourselves, eat well, rest, get exercise, and ensure that we are caring for any chronic or regular health needs we have, including, please get a flu shot. If in consultation with your doctor, that is recommended. So it is 12:50. I see no other questions. Have a great weekend, and I'll talk with everyone next week.
Carl said we must be a tired bunch. Huh? I
Oh,
wonder why.
your volume's all the way down now, so you might want to turn it back up.
Yeah, she usually calls about this time.
That's just telling you.
I was getting ready to say. And Sharon Mebin was calling me on my cell phone while the call was on. Why are you not on? She does.
Oh.
Sharon? Hey, you calling me?
I couldn't unmute myself.
Oh, you couldn't unmute it.
Yeah, and I put in the chat that
You're online. Get offline. You're broadcasting. Make sure you're off. Sorry, guys. I could hear all that conversation online. And there's still 98 people on.